Hi, I am Dr. Vaughn, one of the elite ICE 50 avatars, to present course on National Center for Drug Abuse Statistics. Course 9 of 9. Drug scheduling and definitions are part of the Controlled Substances Act, CSA. Schedule 1. Schedule 1 drugs have no acceptable medical use per the DEA. These drugs also have a high potential for abuse. This may or may not be due to addictive properties. Drugs that are considered gateway drugs, that is, substances that are often precursors to abuse of other, possibly more dangerous drugs, or deemed a public health risk, may also be listed under Schedule 1. There are 250 drugs classified as Schedule 1. Some examples of Schedule 1 drugs include ecstasy, heroin, synthetic heroin, LSD, marijuana, and peyote. Schedule 2. Drugs with a high risk of abuse and little to no medical use. Some of these include drugs that were once common prescriptions, such as laudanum. There are 72 drugs classified as Schedule 2. Some examples of Schedule 2 drugs are cocaine, fentanyl, methamphetamine, oxycodone, and hydrocodone. Schedule 3. Drugs with a moderate to low potential for physical and psychological dependence are classified as Schedule 3. This category includes dozens of hormones, synthetic hormones, and hormone derivatives. There are 130 drugs classified as Schedule 3. Some examples of Schedule 3 drugs are anabolic steroids, codeine, less than 900 milliliters per dosage, and ketamine. Schedule 4. These drugs have a relatively low potential for dependence and abuse. Most Schedule 4 drugs are prescription medications, some of which have been banned by the Food and Drug Administration. There are 82 drugs categorized as Schedule 4. Some examples of Schedule 4 drugs are narcotics, muscle relaxants, and commonly prescribed medications for anxiety and depression, such as alprazolam. Schedule 5. Schedule 5 drugs have little to no risk of dependence or abuse. These substances are not typically available over the counter. 14 drugs are classified as Schedule 5. One example of a Schedule 5 drugs are cough medicines with 100 to 200 milliliters of codeine per dose.